actually, let me just say, I have, you can see the slide here. In fact, it just tells you I have just 3 things to say for this whole talk. And I'm going to repeat them because I think they are very important, and I think that everyone can actually do this. And so it's not complicated. And the 3 things are, so this is why I call beginning with the end in mind. At the end of this talk, I hope that everyone can be a little bit more aware about mental health issues and how it can affect ourselves and the people around us, people that we care about, people in our family and our work. The second one is the need to do a mental health check, self-check once in a while, you know. And you know, just now when we did the body scanning and Angie asked us, can you feel your breath? Are you aware of your feet and your hands, where they are? So that's doing a check. And she asked, what is your mind? What is going through your mind? But how are you feeling? And I think it's useful sometimes for us to do a mental well-being check of ourselves. So that's the number 2. The third thing, of course, maybe many of you came to this talk because you want to do something to improve your mental well-being. So take action. There are many, many things that can be done. I'm going to talk about quite a few of them. And some of them you may already have been doing. Some of them you may learn something new from this. So really, I hope that everyone can take a little bit away from this session. So these 3 things, actually, this is what my talk is about. Be aware of your mental health issues. Be aware of mental health issues, that it can affect you. Do a mental health self-check from time to time. And if you think you're not doing as well as you should be, do something about it. Take some action. Okay. Now, Angie introduced me just now, and I am a psychiatrist. I've been working in mental health care, I think 24, 25 years now. And it's been a very enriching and rewarding experience for me because I've been able to journey with many people who struggle with mental health issues and help them along their journey of recovery. She talked about experience, and really I just thought I'd tell you that it's not really about the research that I've done or the journals that I read or the textbooks. It's some of that, but a lot of it is really learning from my colleagues, learning from other practitioners in mental health care, and really learning a lot from the patients and the people that I come into contact with, because each and every one of them has something to teach me and to teach themselves. And that's one of the points I wanted to bring across. Everyone who has gone through a mental health experience actually and have come out of it has gained something that you can it's a skill that you can take away for the rest of your life, and you can actually impart that skill to someone else. So each of you, and I'm sure every one of us has gone through some mental health difficulties or emotional difficulties. You can help. You've helped yourself, you may not realize it, and you can also help someone else. The next thing I wanted to talk about really was about IMH a little bit. You know, people ask about what do we do and how IMH has been affected by COVID-19. So I thought I'd just spend just a few minutes talking a bit about the work that we do. So this is one snapshot with some numbers about IMH. So we are Singapore's only tertiary psychiatric institution, and we focus on 3 main pillars: clinical services, education, as well as mental health research. Okay. Now, we are a very large hospital. You start to see the numbers below, and I'll try and explain some of that to you later. But really, we're designed to look after people with quite severe and serious mental health conditions. We provide hospital services for both acute as well as what we call recovery care. So maybe I just wanted to just let you know that there's a number that's in green. Actually, we have 2,000 beds in this hospital. That means we can have 2,000 people staying in this hospital every night. On average, this is 2019 figures, we had 1,700 people every night staying overnight with us. Now, and you can see, if you look on the right, of the 1,700 people, actually about 600 to 700 of them are what we call acute care. They've come in for a short inpatient stay. We work closely with them to monitor them and help them to get well enough so they can continue their recovery at home. But there's 1,000 over patients who stay with us on a longer basis, and we call that recovery care because they take a longer time to get well. Some of them have stayed with us for many years, and our responsibility is to provide care for them as if they're part of the family. Now, I just wanted to let you know that there's a bigger number, the biggest number of all. So sometimes people associate IMH with just the hospital and that we look after inpatients. Actually, we have 47,500 outpatients now. This is a much, much larger number than the people who sleep in the hospital at night. 47,500 people who just last year visited us at least once, and many of them more than once in the year. And they have come to us because of various mental health problems. And our work really is to support them, help them, give them the right treatment and journey along with them on their road to recovery. Of this 47,500, actually about 500 to 600 of them visit us in our various clinics every day. So, so that's the number on the left. And of that 47,000, again, 24, on average, 24 of them have to be hospitalized every day, and then they get discharged again. So I thought I just wanted to let you know that we are quite a large enterprise, and we have an important role to play in Singapore. So therefore, how did COVID-19 affect IMH? I think I have many friends and people who do ask me, oh, what's happening in your hospital? How has COVID-19 affected you? And I thought I wanted to just share with you what we have gone through as a hospital, my team and I, all my colleagues, during this period. Now, we had decided very early on that IMH must continue to function and play its role in Singapore as that national mental health center. You must remember, we just cannot stop and say we all work from home and then we also close down. 47,500 people are our patients and our clients, and we need to continue providing for them. Also, the 1,700 who need to stay with us on a nightly basis. So these are the three things. I want to make it simple for everyone. It's for you to know as well, really. I think the number one thing that we must continue to do is to continue providing our services. So our hospital has never closed down during this period of COVID-19. We've continued to keep our inpatients open. Our clinics have still been open, and our emergency services have been open as well, right? We had to scale down some of it, but really we had to make sure that people who needed care still continue to get care. The number two thing, of course, in order to make sure that number one can continue, we must make everyone in the hospital, our patients and our staff and our partners and our vendors who come and work here with us, everyone must be safe from infection. So that means a lot of additional infection control measures. So, you would know that if you've got children going to school or if you're going to workplace, everything, if you've gone to a mall in Singapore, so many checks, social safe distancing, lots of checks going on. And we've had to do all that as well here in IMH. And then the third item really is to make sure that all the changes that we are making, we can continue for as long as COVID is around and is a threat to Singapore and to our hospital and our people. Now, just these three things that we've had to change has made us do things quite differently, and you can imagine has brought about quite a lot of stress to everyone in the hospital. How many colleagues do I have? I have 2,500 colleagues, staff working in this hospital. And we together, collectively, have to change the hospital to make us ready for COVID-19. And you can imagine trying to keep us open, our services, essential services on, keeping ourselves safe as well, adhering to infection control practices, and making sure we have enough resources to go on for the last few months and the next few months if we need to, is quite an effort, and it's been quite stressful. And then on top of that, we just came out of circuit breaker. We have to make sure that our staff and our partners and our patients also can participate in the circuit breaker measures. So that is basically, if we don't want them to travel in public transport and come to us, we need to find a way of delivering care to them, maybe by a teleconsult, maybe by a telephone. Maybe we can deliver medicines to them instead of making them come and queue up in the clinic. So that's additionally. And the last one really is mental health obviously became an issue and a concern for many people who had to go through the stress of COVID-19 and circuit breaker. And many of our doctors and psychologists participated, and allied health professionals also volunteered their time to work in the National Care Hotline to pick up the call for people who called in who had difficulty or emotional problems and needed some help. So really look at these things, really a lot of additional things that we had to do at the Institute of Mental Health. Why am I telling you this? I guess I wanted to just let you know that we, as a hospital, are just like you at your workplaces. We've had to go through lots of changes as well. And really, what does that mean? Two things. One is it can be stressful. And back to my first point, we need to know that it can be stressful and we need to look after ourselves as we go through this period. And the number two thing that we have learned is that collectively, when we work together and help each other, we can get things done. That's the second thing I've learned. So we had to do all these new things. We had to do teleconsults, psychotherapy, providing therapy through Zoom like this. We had to make sure medicines were delivered. We had to go through patients who couldn't come, calling them to make sure that they're all right at home. And we still had to do home visits for patients who were in crisis. So these are all the things that we had to do. Right, so back to this point. So I wanted to just tell you a little bit about IMH because we have learned a lot about ourselves. And now these three things too, actually. We have to be aware about the mental health of our staff and of our patients, what's going to happen to them during this period. We need to check ourselves from time to time. How are we doing? And the third thing is we need to take action to make sure that we are doing all right. And this is the third thing I want to talk about, you see. So our psychologists and many of our clinicians came together to say, let's see how we can look after ourselves better during this stressful period. And they came up with a whole series of tips and help, tip sheets, and little self-help tools, which is going to be what I'm going to share with all of you because it works for us and I'm sure it'll work for many of you as well. And so some of the little things I'm going to tell all of us that we can all do came from our psychologists designing little self-help skills that we can all apply in IMH, and I think they will apply to you too. Okay, so now let's talk about how COVID-19 and the changes that we're going through in Singapore is affecting all of us. I'm going to talk about different groups of people, and I think many of you in this audience probably fall into this category. You're adults and you're part of Singapore's community, right? And I think you've gone through a difficult time. All of us have, and some of us have struggled through this period more than others. I've had people who told me how difficult it is because they were very outgoing. They had many social contacts. They had many activities that kept them out of the house almost every day. And suddenly they were confined at home and they couldn't even go to work and they were asked to work from home. It's a loss of their sense of freedom, the need to have face-to-face contact with other people. And some people just find that the phone or a Zoom meeting is not the same. And actually even more, it's the worry about how long this is going to last. Now, these are certainly things that can cause quite a lot of stress. Now, so how does that translate into your emotions? So I think this is the part about knowing about the feelings that you can experience. Yes, talk about you experience frustration, anger, you might be irritable, you might snap at someone, or you might feel an overwhelming sense of worry and anxiety. You wake up feeling very anxious. Some people cannot sleep because they are feeling very anxious. And some people feel alone and very lonely, or they feel very bored. It can bring about strained relationships. I mean, if you're feeling very stressed and you become irritable, then you're not very good company. And then you may cause a lot of stress to the people around you, right? And so I think that's the first point. You must be aware that the feelings that you're going through are a result of the changes in your life. Now, I bring this up because the IMH has done several studies, and one of the studies we did was what we call mental health literacy. We realized that we, as Singaporeans, are sometimes not very good at identifying emotions or being aware of mental health problems. We asked Singaporeans to tell us whether they can recognize different mental health conditions, and only 60%, 6 out of 10 people could, say, oh, this is, someone like this is going through depression or anxiety. 4 out of 10 couldn't figure out how to understand the person who's going through a mental health problem. So I think that's very important. So the awareness, that's that first point. So the next thing is then, of course, what do you do, right? If you have some of these emotions. So, again, we have seen actually some of these mental health issues exploding into the public. Anger management, people being unable to adjust, comply with the need to have safe distancing or even to wear a mask in public because they feel so frustrated, anxiety and depression. I think we put these clips because I wanted to let you know that it's not a silent or a hidden problem. I think as a country, we have are much more aware than we were before about mental health problems. And today, there's a lot of public debates, there's a lot of newspaper articles and social media comments about mental well-being. And that's a good thing because we all need to be aware. That first point, be aware of mental health issues and how it can affect us. So that's great. I think it's good that we acknowledge that these things can happen. We need to be aware whether it's happening to us or not. And that's the main thing we'll talk about next. Now, we'll do a little bit of self-check later, but let's talk a lot about tips that you can do if you are experiencing some of the things that I just talked about just now, the frustration, the worry, anxiety, depression, irritability, etc. And I talked about the tips that my colleagues in IMH have come up to help us continue working well in IMH. And so these are two little posters that came up in our hospital. And let's look at which one first. I mean, the one on the left-hand side really is about exercising. I know many of us think they know this, but I don't know how many of us actually do it. So these things are not rocket science. They're not going to tell you something that you don't already know. In fact, some of the things, many of these things you already know. It's just whether or not you are actually doing them. Hopefully, after this little session that we have together, you may take some resolve to actually do one or two of those things. Exercise regularly. Schedule some time for kindness, a simple kind act. Look out for good news. I mean, many people have told us, my patients as well as my colleagues have told us, it's endless news about COVID and gloom and doom and terrible things are going to happen to us. And really, it's sometimes you feel that I need to know more because just in case I need to do something about it. My advice is if it's affecting your mental well-being, too much information is not helpful. Look for some good news. Then we had one of these tips that says go and look for those YouTube kittens and funny puppies. It does work. Just helps to relieve the tension for that moment. We have to socialize creatively, video calls, phone calls, WhatsApp videos and things like that. They do work. The little picture at the bottom there, you can see is what Angie was just doing really. It's centering ourselves, doing a bit of a relaxation exercise, slow breathing, counting your breaths, being mindful of the fact that there's breaths going in and out of you and everything else is actually all right for the time being, at the moment. So these are things that you can do. The poster on the right, more ideas really. It's about self-care. They talk about writing a journal. I'm not sure how many of you do that. Exercise again, playing games with people, and actually there are some online games that some people have told me are quite fun actually. And the right-hand side of that house says trust and gratitude. Now, this is something that I think we talk a lot about, but I don't know whether we actually do it. And it's really about reflecting, having some quiet time to think about the things that we are grateful for that could have gone wrong but didn't go wrong. We unfortunately, I've noticed that people tend to focus a lot on all the bad things that happened, and they don't praise or celebrate or comment or acknowledge the good things that happened, or in fact the bad things that never happened, despite all the worry that they did. And in fact, if you prevented something bad from happening, well done, so that's great. Prepping yourself, making sure that if you're going to be working from home, you need to make sure that, and I think under phase 2, many of us will still be working from home. You still need to perfect that art of working from home to make sure that things are okay, and that you have a workspace and that you don't mix up everything, so that basically you find that you're working from day to night and there's no end and no boundary difference between work and home life. Recharging, everyone has a different way to recharge, whether it's exercising, whether it's connecting, having a good meal, having a warm shower. And the last point really in this slide, I thought is something that we don't do enough. It's connecting. Just texting someone to ask how you are and telling them how you feel. I think these are very simple things, but I don't know how many of us actually do it all the time. More tips that came up from my own colleagues, really, I thought I'd share with you. If you are starting to feel down, there are a lot of things that you can do to help yourself. You can pick yourself up on a daily basis to give yourself a bit of encouragement. It might not work all the time and you may need additional help, but you can certainly do some of this. Even if other people are helping you, you can still help yourself. Simple tips: if you're going to be feeling down and out and you're moping around in your pajamas the whole day and you don't feel like getting out of bed, get out of bed, get dressed, and try and stick to a daily routine. It may be difficult for some, but for other people, just the act of doing that and self-care tells you that I do care for myself. I'm going to get help. It's a tough time, but I'm doing the best I can for myself. A little treat for yourself. We can have bubble tea now. So I know that seems to be a big favorite here. So a lot of pictures there are the same, along the same vein actually, of trying to be kind to yourself, treat yourself kindly, do something fun. Even if things are difficult, it's all right for us to take a short break and be kind to ourselves. Watch a funny, this is the one about cute animal videos. Take short walks. Ladies said, wear your favorite skincare makeup. For the guys, we should shave. I've seen people who didn't shave because they're working from home. I don't know if it makes them feel better or worse, actually. So the impact of this really is, I think people feel stuck and trapped. And so you should realize that you are starting to feel that way. Let's do some of these things, okay? So, I'm leaving the rest of the slide for you to read, and I'm sure you had a good look at them. And I'm sure you're starting to realize again, hey, I could do some of these things, I didn't try. Or you may have said, yeah, I tried some of these and it doesn't work. Then try some of the others, okay? Now, I thought I'd talk a little bit about kids, because many of you are home with your kids now. Shouldn't that be very nice? Unfortunately, sometimes it's quite stressful. And we've seen articles about this in the papers and in social media about all trapped together. And sometimes they call this cabin fever, right? And people who are not used to being together are now together. And for the kids, it can be a frightening or an anxious time for them because suddenly they cannot see their friends in school. They have to adapt to technology at home and have home lessons. And then, they've got their parent with them all the time. And it's a different feeling. Let me just share a tip with you. My colleagues who work with children have told me that actually children are actually more adaptable than adults in many ways. Children need just a few things. Actually, they need to have a sense of security. They need to feel safe. They usually feel safe when the people whom they trust and they love are around them. So actually just being the parents, being at home with them is half the battle won. And the parents mustn't be anxious or feeling very in distress. Though I mean, if the parents are in distress, then the kids can feel it. But if the parents are calm and they are able to explain the situation, and the kid knows that there's not much danger to him or herself, that's half the battle won. Kids also just like to have someone to follow. They model. So if the parents are doing something that is wear a mask, they practice social distancing, the kids will pick it up quite quickly without questioning too much. So it can be challenging, but it's also not impossible. Some of the points here really are the kids can feel overwhelmed if the parents are feeling very upset and emotional and keep talking to them about COVID and changes and they can't do this, they can't do that. Focus on what they can do and what are the fun things that have happened instead of having to go to school, and they can do some things together. Right at the bottom is again being aware. So when kids are feeling stressed, they get angry, anxious, or depressed too, and they can throw tantrums. So this is not, again, your kid being bad or being naughty. They're just expressing the emotional distress that they're feeling. Being aware, that's that first point that I talked about. So many of my colleagues have kids. And we came up with a lot of tips as well to help the kids of our staff. I mentioned, I'm sure they apply to all of you as well, right? So right on the top right-hand side, it says parents can make a big difference. And I mentioned just now, we as parents need to stay calm. If we're panicking, the kids are going to panic. You need to find out, or you can observe. I talked about the number 2, do a mental health check. See how your kid is feeling. If your child is fretful and anxious, you know that there is something that you need to do something about. What you can do is provide them security and safety, that this is all right. It's okay that we are together at home now. It's okay that we stop going out to our usual playgrounds or fast food place. It's all right because we will be fine and safe as a family, and we'll do new things together. And that is that whole little squares at the bottom about having a new routine for the family, and it starts off by saying have regular check-ins with your children on their feelings towards what's going on. Give them a special space for them to do some studying, remain calm, let the children stay in touch with their friends if you can, right? Give them a lot of encouragement. Actually, some of these apply to ourselves as well. When we do something well, we don't pat ourselves on the back. And when our kids do something, they completed a school assignment and they managed to they managed to go out and wear a mask throughout the period, and we need to congratulate them and give them a pat on the back as well. Routines are important for children. Have meals together as a family. In fact, many people who said that actually this one of the good things about, not good things, one of the things that were not so bad that came out of the work from home was they spend a lot more time with their family and their children. And with adolescents, it's sometimes a little bit more stressful, but actually it works too. Adolescents do like to be with their parents too. It's a changing time for their relationship. But being together allows them to understand their parents in a new light, and for you to understand your kid as well, who is transitioning into a young adult. Right, so I think we talk about helping adults, helping children. So it's the same theme. We keep talking about being aware of mental health issues, do a mental health check, and then take action. So I'm actually going to ask us to do something together now, which is I'm going to ask you to tell me how are you doing. Cheng San from Brahm is going to help us to start a poll. Cheng San, are you on? Yeah, okay. So I think, based on what we're doing, you can start doing this now. You should be able to, you're supposed to be able to vote. Yeah, that's right, and we'll count. So I think there's 360 of us in the room, and let's see how it's doing. I don't think you can see the results now. We will show you the results when it's all done. And I'm telling you now that 130 out of 360 have voted. Very good. Let's see how far we can go. Angie, how are you doing? Tell me how you're doing.
I'm good, thanks, Prof. And I'm seeing the results. Most people are actually feeling fine, so that's really good. Now, I recall you mentioning about the parents and kids. Somehow I think a lot of parents think that, their kids would just know what to do. But I think as parents, we need to guide them, like help them plan their day, because they've never spent every day at home. And this is a unusual way for them to be spending their time. So it's actually very helpful if parents would sit down with them and plan out each of their hours, even when they don't have any classes on.
Yeah. Indeed. So that part about routine, right, is a simple word, but actually it's a very big thing to do, because I think the whole routine, kids love routines. They love it. They sometimes struggle when they don't want to go to bed. But actually having regular bedtimes, eating times, going to school times is actually very good for your children. So basically, when they all get disrupted, it's very important for parents to understand that they need to build that structure around the kids again. You're right, Angie.
Yeah.
Okay. So it looks like we have stopped the number of polls, almost 300 out of 360. I think it's fine. Well done. Thank you very much for participating. Let's show the results. Can we show the results to everyone? Okay, you can see this, right? Okay, sharing poll results. So I think there are 360 people in this room, and almost 300 participated. The numbers are actually there. So 157 of you, 53% of you say you're fine. well done, I must say. I don't feel fine all the time. And I think, how are you feeling now? And I'm very, very happy to know that. Okay. Feeling a little stressed up to 30%, 90 of us are feeling, and honestly, before this thing started, this webinar started, Angie and I were going through a little bit of stress because we had some technical difficulties and I couldn't get on. My point is, feeling a little stressed from time to time is more than normal. Every one of us should feel that. We should know that we are stressed though. And Angie told me when we were preparing this, don't worry, Choon, there's time. You see? And that really helps to diffuse the tension. And I say, okay, we'll try again and log in again. Right, Angie? And so
Yep.
it's recognizing it and taking a quick action to calm each other down. So that's, feeling a little, of course, feeling stressed sometimes, I think all of you know, is actually quite helpful. Because if sometimes we don't feel a little bit stressed, we doing things a bit too slowly. Having a little bit of stress to make sure that the meal is ready on time, or the kid gets to bed on time, really, it's useful because it helps us to get things done or get assignments that need to be done. 15% of you, 43 said, it's quite stressful, but I'm hanging in there. Thank you for acknowledging that feeling. I hope you can pick up a tip or two from this seminar, and you need to practice more self-care. And 6 of you say it's really very stressful. And yes, it can get very stressful. And that's why there are people and organizations and that can help you. And I will talk a little bit about that next. So can we stop sharing the slides, the poll results? Okay, I can do that. Yeah, okay. I'm going to go to the next slide really and summarize really, the findings, the results that we had from the survey. If you're feeling fine, that's 50% of you, well done. That's great, keep it up. And in fact, I'm going to ask you at the end of this webinar to share your secrets. Because if you can do that, other people possibly can learn a tip or two from you. Feeling a little stressed, as I said, that's quite normal. Stress can sometimes actually help us to achieve more. Stressful, but hanging in there. Let's pick up a tip or two from each other today. Really stressful, maybe you should get some help. Try helping yourself. If it doesn't work, and if all those things you try and you cannot manage, get some help. And the last one, no one today put that category, but I've done a talk before and people have picked that category, and you really, really should reach out for help. And we put on this slide here, but this information is available quite readily, that you should call for help. If you know someone who is in that situation, the help, I can't cope. These are the numbers to call. Take a screenshot if you want, because you can help someone to help themselves to reach out. The National Care Hotline is the number we put right at the top. And that is the hotline set up by the Ministry of Social and Family Development, MSF, really to serve Singaporeans and all of us at this time of crisis during COVID-19. Okay, I'm going to finish up the talk by talking about some special groups. I won't spend too much time because we can have a little bit of a dialogue at the end, or Q&A if we have some time. But really, it's about trying to recognize that not everyone is just an adult or a child here. I think we need to recognize in Singapore there are some vulnerable groups who are maybe experiencing additional stress. And how are we helping? Usually in a talk, I'd ask my audience, how many of you are healthcare workers? And I mentioned, right, so a lot of this work comes from the fact that we learn from our own experience at IMH. We felt stressed too. And my thoughts and reach out to my colleagues in other healthcare organizations in Singapore, whether it's Tan Tock Seng and the NCID or all the other public hospitals who are out there dealing with patients with COVID, and also setting up medical posts in the community and serving many people who are affected by this condition. So really, it can be quite stressful. And you all have all seen pictures of the healthcare workers in full PPE, right? They call that thing where they wear the whole gown and gloves and goggles and masks. So if you're a healthcare worker, it can be exceptionally stressful. I know many healthcare organizations have put in place various things to help their employees to work more comfortably and more safely, and to feel more secure about their work. And all of you who meet a healthcare worker, really, please show some appreciation because it can be very tough for us. So dealing with anxiety, changes in work routines, and of course, there's always this fear if you're working in a hospital that you may come into contact with someone with the virus, and then there's always this fear of bringing it home to your family members. So I think this is important. Healthcare workers are really stepping up now to do a lot more, and they are at risk for burnout and fatigue as well. So in fact, we do have quite a lot of, this one is the IMH one, staff wellness support framework. So I think we do need to make sure that, if you're a healthcare worker, you need to do that self-check as well. And you're not feeling so good emotionally, reach out, put your hand up and tell someone in your team, your manager, your nurse manager, your head of department, I need some help. Say I went to this talk and the doctor said that it's normal for me to feel stressed. I need some help. So these are the things that we can do. So healthcare workers. There are some other vulnerable groups, and I'm talking about persons who already have mental health struggles and mental health issues. And so this is part of our work. We need to be aware that many of our patients and their caregivers may experience even more stress. Some of my patients, and I'll tell you different stories because, of course, in the last 2 months or so, 3 months, I've still been seeing some of my patients. And they've gone through different experiences. Some, yes, have struggled through and felt even worse than they already were feeling, and felt that really, the cutting off of social ties and helplines and the regular routines made them feel even more anxious or even more depressed. And we were helping them to overcome some of these difficulties. Interestingly, what I wanted to bring across this point, that what happens today doesn't necessarily mean it's going to continue for the next week or the next month. I've had patients who have initially had a tough time with the circuit breaker measures because they just found there was such a disruption in their lives and they couldn't do all the things, including work. And then they were left by themselves and they were overwhelmed by their emotions. But, interestingly, over time, they allowed themselves to adapt and just accept the changes. And some of them actually felt better after a while. In fact, some of them who have been experiencing a lot of stress from work said that now actually working from home and the boss not being there or looking over my shoulder and asking why is that not done actually was a bit more less stressful than before. So after the initial change of having to adapt to working at home and couldn't check with their other colleagues, they found actually was quite okay. For people who do have mental health problems, it can cause a change. It not necessarily becomes worse. It can actually get better for some people. Some patients have relapsed. And again, we have reached out to our patients to contact us if it's affecting them badly and they are having worse symptoms and they may need to come back for urgent care, right? And so if any of you know someone who is struggling with mental health problems, this is additionally difficult time for them. So ask them how they're doing. Same principles apply. They can also help themselves or they may need to get additional help for their problems. This is a group that's often talked about, individuals who are in difficult situations at home, with already broken down or difficult relationships to handle, with abusive relationships, and the circuit breaker, which is over now, spending time at home in a confined space with people who there's a lot of tension can cause problems and more frequent or abuse. And in this group, really, we ask individuals who know of such people, or if you feel you're affected, you must reach out. You must call one of those hotlines or make your way to, well, I'm not saying to IMH, but necessarily you need to go to get help, whether it's one of the family service centers, a community center, make a call, go and see a GP, a family physician if you need to, just let them know that you are in a state of distress and you need some help. Okay, so we need to recognize that this is a group that is vulnerable. There are also persons with special needs. These are individuals with maybe physical disabilities or intellectual disabilities. circuit breaker, as well as all the changes in COVID-19, can cause some distress to such individuals. You know, I listed them down there. Really, confusion, also disruptions to routines, lack of sensory stimulation. And again, so the last 3 points is really recognizing that this is a mental health issue that we can do something about, because you get tantrums, the behavior changes. And so you need to recognize that this is not normal and that we can do something about it. Try some of the techniques we talked about earlier, you know, putting back that routine, asking them how they feel, try to give some explanation, and see if it works. And if it doesn't, reach out for help. There you are. So supporting individuals with special needs. In fact, some of my colleagues, together with colleagues in NUH as well as Sing Health, NUHS and Sing Health, actually had come up with a little care kit for people who are caring for individuals with special needs. I think if you go to the IMH website, you can get a link, a copy of this resource, which is online, which is a soft copy book that you can have, little tips that you can help if you are dealing with someone with special needs. One last group I wanted to talk about really are, you know, people who have been going through a particularly difficult time in Singapore, and you know, it's our migrant workers who've come to work and build Singapore and do many essential jobs for us. So of course, we know it's been an extremely stressful time for them, from fear to being infected and the uncertainty over their future. Just wanted to let you know that we haven't forgotten about this particular vulnerable group. IMH has got doctors and nurses who work with a leading NGO, HealthServe, that supports the migrant worker population during this difficult time, right? And so thought we mentioned that as well. Last group to mention really is the elderly amongst us. All of us have older friends or relatives that we care about, and we mustn't forget that this can be a difficult time. You know, many of us are doing okay today. Check in on someone that you know who's older. It can be an auntie, uncle that you know, or a parent, grandparent, your neighbor. Just checking with them to find out how they're doing. We've read a lot about how some of them get disconnected from their children, especially during the circuit breaker period, and they don't know how to access them using technology. And they feel very isolated and they don't know what's happening around them. So reach out to them. The same 1, 2, 3, be aware that they can go through a mental health challenge because of the current period. Ask them, don't assume that they're doing okay. Do a mental health check on them and say, you know, uncle, how are you feeling? You know, what's happening with you? Can I help you? Which is the third point. You know, can I give you some, you know, can we do something together that, you know, I can help you with so that you can feel better? Help them and try and get them to help themselves, or help them to get help if it's necessary. Okay, now I'd like to really end on 2 points really that, you know, that as a country, I think we have recognized that this is a difficult period. Many people have come to ask me, so are we going to have more mental health problems in Singapore? And the answer is, I think we have to be prepared for mental health issues, because it's going to be a difficult period over the next few months or even in the coming years. Not everything is what a psychiatrist calls a mental illness. We have mental health problems because of the things that have changed around us. The circumstances about whether our work will be the same, whether our families will be affected, whether our children's schooling will be affected, whether we can travel to visit people overseas, and if our business, our work involves traveling. There's so many uncertainties. And we also know that we may be facing economic issues and a recession. So all these issues are going to contribute to our mental well-being. Now, just this slide shows you that as a country, we are coming together we recognize this. That first step, we have to recognize that there can be mental health issues. And so these things, which are all about budgets and supporting us through this difficult time, all of us in Singapore, is actually one way to help to prevent mental health problems from overwhelming us, right? So it's something that we're doing together. These pictures, of course, are what I think our government is doing for us. But can you do something for your friends and your community? Can you step up and do something for yourself and your family too? I think everyone can do some of that. And that helps prevent too many mental health issues from becoming a problem. There will be some people who still need help. And again, in anticipation that it's going to be a difficult time, there are help lines available. So earlier on, there was that slide that had the helplines, and I hope maybe you needed information. It is all available on the internet anyway. But this was one I wanted to talk about, the National Care Hotline, that number there, 1800-202-6868. When it's set up by MSF, my friend Vivian, who's helping chief psychologist there, and really it involves many professionals from many agencies, many from IMH, participating in the hotline. And it's a good resource. If you need help or you know someone who needs help, give them this number, ask them to call, because they get someone on the other line to talk to them. It's a real person who listens to them, finds out what their problem is, and if it's a mental health related issue, they are channeled to a mental health professional to speak. Oftentimes, though, it's about financial issues or economic problems, about work issues. I've lost my job. What do I do? And the helpline is also able to help direct them to the right resource. Okay, now we have come to 12 o'clock. I mean, I see you guys are still there, 360 of you. Amazing. Thank you for listening. I hope you picked up a tip or two. And actually, I thought now we can do something together. Just reminding us, actually, I wanted to summarize, because basically, these are the three things I wanted to say, Angie. And I wanted all our participants to, and I say them again, a bit boring, but actually really important. Please be aware of mental health issues. Two is do an occasional mental health check. The way we scanned our bodies just now, do a check. And then take an action to improve things, okay? So now I'm going to ask all of us again to participate. Can you go use the, stop the share, right? So maybe you can stop the share. Oh, can you use the Q&A section there? Okay, we'll go back up later to see about answering questions, but I thought maybe at this point in time, I thought it's useful for all of us to help each other by sharing each other's tips. Angie, what do you think? Should we answer some of these questions first or get everyone to help each other?
Yeah, I think it would be good to have some of these questions answered. But I just wanted to chime in that it's so important right now that we focus on what we are able to do, rather than lamenting on the things that we can't do, including just checking in on your neighbors. And if you are cooking something, cook something extra and give it to your neighbors. It's a shame that in the work that we do supporting the elderly in some of the communities, we found one of them had died and the body had to be taken away by the police because the neighbors were not even aware. Another man had a heart attack and was lying in his urine. Fortunately, it was found by one of our staff. We called the police and he was then transported to the hospital. He died a few days later, but that's much better than lying on his urine and feces and being starving and feeling thirsty. So I would really urge all of you to show some concern and care to the people who are just living next door to you, and do an act of kindness by even just saying hello or sharing something that you have. If you're going to the market, buy something extra and give it to the uncle or auntie next door.
At workplace as well. I've seen, IMH are very fierce. It's very strict now. We cannot eat close to each other. But it doesn't stop us from delivering cookies and giving someone something that you made at home. And I think we can all do a little bit more. So I think this is a time. Let's look at the Q&A. I'm not sure how because I really...
Okay, shall I read it to you?
Yeah, you may.
So,
I can. Which one should we answer? Pick one or two. How does I
Okay.
help patients who don't want to come appointments and don't want to take medicines? It's a tough one. I think really it's about having a relationship with them. So they feel that they are unsafe about coming to us, and or maybe they don't even recognize that they have an illness that needs help. Really, I think we have many partners in the community that you let us know who they are, and we will reach out through our partners. Brahms is a partner, for example, and they will do a home visit, try and make friends, try and get them to come help us. If there's a crisis, there's actually a helpline that you can call to IMH, and basically then we will, if it's a crisis, we do send help immediately. I'm just picking some other questions. Anxiety from unable getting support and resources easy and fast. IT support. Oh yeah, this is about the work from home, and don't we all know it? First of all, can I just say that anxiety, when things change, when circumstances change, and the way you work and the way you live your life suddenly has to change, is anxiety provoking. So first of all, I think applying some of the mindfulness principles, accept it. There's nothing wrong about feeling anxious because things have changed. So like just now, I'm trying to log on and I couldn't, and I said, oh, what are we going to do? And we just accept that, okay, this is going to be a bit of a glitch. We have some time, and slowly we'll fix this. So be kind to yourself, be kind to the situation. I think Angie wrote an article a couple of weeks ago about not judging, and not judging or blaming and saying, all this work from home is a damn nuisance, and I blame my boss, I blame the IT support. Actually, I think they're trying their best as well. So I think the answer to that question is stay calm. I'm sure your boss will understand that you cannot get things done as fast as you normally could. Explain why, ask for help, wait for the IT support to come and get those things that you need to get done. Prof, do you have some tips on how we can establish work from home boundaries? Stop the urge to check email. Okay, sometimes I'm a bit guilty of that. So I tell you what, you should try really to silence your phone or stop checking at a certain time. I'm not going to tell you what time I have to do that. I have to stop doing it. But it's a bit of discipline, and I think the anxiety, of course, is I might miss something urgent might happen, and I won't hear about it. But I think you need to give yourself that break time. So I think the boundary is important. Yes, my colleagues have told me sometimes working from home is actually stressful because there's no boundary between work and personal life. Set your office hours. If you're starting later and you end later, but there's still an end time. If it's 6 o'clock or 7 o'clock, that's the time you break off and spend time with your family and log off. And maybe you can tell your colleagues that I'm not going to be checking my emails. Anything, just call the phone. So if the phone rings, then it's an emergency. Everything else, by message or whatever, you're going to check later. I know it's easier said than done, but I think sometimes we don't even bring the subject up because we are so paise and shy to be the first one to say that in the office. So I think I'm giving you permission to do that. If any of my colleagues are out there, please do that as well. Tell me I'm not taking your call after a certain time, CEO. Okay, Angie, any things to mention there?
Well, I think this is where we have to set our own boundaries, right, in terms of self-care. So we say 8 o'clock is the time, then we have to make sure we observe it because it's not like our boss sometimes is the one who insisted. Yeah.
Indeed. Someone wrote about caring for seniors and a serious misconception in IMH about IMH that person is that someone goes to IMH, that person is lost and no more functioning. It's like a death. Yeah, it's very sad. I'd like to think that IMH, together with many of our partners, including Brahms and many of NCSS, I would like to list some of them here, but there's so many partners: the Singapore Anglican Community Services, Singapore Association of Mental Health, Silver Ribbon. I don't know if you're out there listening. Club Heal, Resilience Collective, Amokyo Family Service Center. So many of our partners, Agency for Integrated Care. There are many partners today that are really trying to change people's perception of mental health and mental well-being. And seeking help is not okay. I think if you don't get help and you don't do anything until it's really late and it's bad, of course, then if you go to a place and it's so much harder to get better then. The idea really is my 3 points again. Recognize that mental health issues can happen to anyone, and it can really happen to you or someone you love. Do a check. Don't be shy to ask how they're feeling. And if they're not feeling good, try to help. They can help themselves, you can help them. And if they need help, bring them to a professional. IMH, I mentioned we have recovered, we do a lot of work with people who have acute crisis. They get well, they improve, they recover, they get back to on their life, what they were doing before, and we support them. And even if it takes a long time, I like to think we never give up. We always work with our patients as long as they continue to stay with us. And I think maybe that's the message you can share with people who have concerns about mental health care. So many questions. How to manage if just got very upset at work easily and BP spike up to feel dizzy. I think this is right up Angie's path. So this is something that happened, and we get really worked up, and you lose emotional control, and you find your whole head is going to burst. What do we do, Angie?
Well, I'll put in the plug. I will be running the next mindfulness-based stress reduction course starting Tuesday. So if you'd like to learn how to manage your stress or relieve your stress, it's important to have the right techniques and skills to do it, because we can't just leave it to our own coping skills if we don't even have them right now.
Yeah, indeed. Well done. So tune in for next. Are you doing this next week, or there's a course, right? That you're helping us to. So that
Tuesday.
That little thing we did at the beginning, that mindfulness, that relaxation exercise, really, I wanted to just say, that practice makes perfect. Oh, don't know whether we got time to do one more round of that near the end. Okay, there's so many questions. I wish we can answer all of them, but I really wanted to hear from you. Just one last question. How do you think we can reduce the stigma of seeking mental health for those who do not have severe mental issues? I think you can be an ambassador. Tell them what you heard today, that mental health can affect anyone, and that then if you check and you find that there's an issue, the earlier you find and do something about it, the better. And not everyone has to go and see a professional or psychiatrist. We can help each other. There's a lot of resources available online. And so, if we all talk about mental health in a very positive way that we can improve and help each other, it doesn't have that stigma of, people who have mental illness must be really, in a bad state and nobody can help them. That kind of thing is the thought that brings about the stigma. Okay. Okay, maybe I really wanted to do this, I really want all of you, as many as you can, in the Q&A section, please share with me and share with each other the things that have kept you going during this difficult COVID months, so that other people can learn from you. I've been talking to you, and I'd like to hear from you. What have you been doing? Just type in under the question, right, and Q&A, right?
Yeah. Chian, can you turn on the chat so that people can use the chat? It might be easier.
Okay, we'll turn on the chat function.
Angie, unfortunately, the meeting have to restart if we turn on the chat.
No worries. Okay.
All right, they are coming in. Cherishing family time. I'm going to read them up. Family time, really, yeah. Signing up for webinars. Okay, I think it stopped raining though. I think you need to go out for some fresh air. We'll keep scrolling them, yeah. Exercise every day at 6 p.m., 20 minutes to 1 hour. Well done, John. I think, I don't know. I mean, a lot of people say they do, but when you actually ask them, do you actually exercise or not, then they'll say, oh, only once a week or maybe once or twice a week. So I think really the discipline of doing it every day, really helpful. Well done, John. Baking is such a common thing, right? We got a crisis in Singapore over flour now, right?
Yes, not enough flour.
I'll tell you a funny story. One of my patients tried baking and it was very stressful for her because she couldn't get the flour she lined up. Then later on, she made the thing and the family didn't like it, so very stressful. But you know what? There was a happy story to that. So I'm not going to do baking, it's horrible. And she ended up doing knitting instead. And she said that one, no one was competing with her. She could get the wool and she could do it. And everyone was appreciative. Making masks. I've seen my colleagues, many people have been making masks, and I think that's a fun thing to use.
Well, you can fry noodles and make kueh.
Spirituality. meditation, and I guess you're plugging the mindfulness concept. Pet therapy works wonders. Yes, indeed. If you don't have a pet, you can see other people's pets on YouTube as well.
Or adopt a pet from SPCA.
Helen, thank you for reminding us to be positive. There's many, many things to be thankful and grateful for. Sometimes we don't look at it, and it's just looking at all the negatives that we have. Spirituality and religion, thank you for sharing that. Art, spending time with your parents, that's nice for sharing, Desiree. Yeah. Exercise, go for a walk in nature. Catherine Chua, I think I know who you are. I think she's a regular jogging. Yes, I know. It's for someone for any age can do running as well, or jogging. Yeah. Manheng, hi, nice to see you in this chat. I know some of you mindfulness from Manheng. A tip that helps me from Frank: do periodic checks on how well I and my loved ones are satisfying our basic needs. Yeah, so that periodic check is really what I was talking about, isn't it? Because sometimes we just assume that everyone is fine, and we don't ask, and just ask how are you doing, and you're not. Listen carefully, and let people express how they're feeling. So a check, that's very helpful. Cooking for my family, yeah, cooking for my parents. I'll tell you a funny story because I went to the hawker center and I asked the guy that I usually buys food from, and he said, "This is no good, huh?" And I said, "Oh, why? But you know, people can tap out, right?" He said, "No, but people nowadays they learn to cook themselves, you know. So I think if they better cooks, my business is going to be in trouble." So I mean, I wouldn't say it's a funny story because on the one hand, yes, people have learned to become better cooks. But you have to worry about the livelihoods because things are going to change. So this is where again, if he needs help, you know, he may need to have some help coming his way. Zoom breakfast, well done. I hope you guys are all looking at the Q&A and chat and scrolling that up and down as well, like I am.
Yeah. I would say sign up for courses. Like I don't have much time because I sign up for courses offered by Oxford and Brown University and so on. Now you can attend courses from all over the world. People have become more savvy online.
Yeah, indeed. Are you scrolling down, Angie? It's really amazing. I hope we can collect all this and maybe we can put all this up on the Brahm website so that people can remember all these are the things that have contributed by all you people who have really are doing well and are sharing what you do. Looking up at the sky and reflecting, I like that one. Really, yeah.
And I think to the parents out there, please learn how to play some video games so that you can actually play with your kids instead of complaining about your kids playing video games. Engage them.
Zoom parties, yeah, why not? Looking at flowers. Singing songs even though it's out of tune, I love that one, really, yeah. Why not?
Yeah, dancing.
Dancing. Gloria says, show gratitude. That's another one, like looking for positive things that we really, really don't do enough. I'm guilty also, and really we need to do that much more. Yoga, mindfulness, painting and art and craft work. So many people talk about being mindful, looking for a day of fulfillment. Yeah. Someone's talked about coffee. Yeah. Reading. Someone talked about reading and listening to audiobooks. Actually, it is actually many people who have told me, and my patients too, actually, they spend time reading, and it's been a very good comfort to many of them. Yeah. Gardening, photography. Yeah, the funny cat video. Definitely. Funny cat is cute cat videos. It just cracks you up for a short moment, and it's really fun. Someone suggested storytelling. Tell your story and how you've been doing, and ask them to tell their story too. Indeed. Fantastic. I think you guys should just scroll down. We will never end with this, but it's wonderful. I think thank you all very much for coming and listening and spending this time with us, and me and Angie. We really appreciate this. Keep looking down and looking up the list of the various things you've mentioned. All wonderful. Thank you all very much. Angie, how shall we end this? You want to just do a quick centering ourselves? In fact, looking at the list gets you back. And sometimes, I think we should calm ourselves.
Excited. Sure, I'll be glad to. Let's do a 3-step breathing space, which is taught by Oxford Mindfulness Center as part of the Mindfulness-Based Cognitive Therapy course. And this might be very helpful in terms of centering ourselves and just kind of regain that little extra calmness for our mind to have more space in order to see things in more in clearer form, as well to make better decisions. So 3-step breathing space starts with being aware of our body, which is slightly similar to what I brought you through earlier on. And then centering on the breath, and then back to just being aware of the entire body again. So those of you who may be signing off, thank you for joining. I'd like to acknowledge Turbo One for sponsoring this talk, in particular Mr. Albert To. And those of you who are staying, please join me in this mindfulness practice of 3-step breathing space. So find yourself in a comfortable position, nice posture, supporting your lower back, closing your eyes. And let's start with 3 deep breaths. And just be aware of how you feel in this moment, right now. If there's any presence of emotions, feelings, and what's the weather like up in the mind? And noticing any body sensations that may be present. So we do all this without any judgments. It's just being aware. And if there are sounds that you can hear, take note of what the sounds are. Could be dropping of the rain, doors opening, closing. And just to take note without any judgments. And now let's become more aware of our body, starting with our feet, knowing where they are. And just feeling into your toes. Other feet happy where they are. If not, adjust the position. Move them. Flex them. And then noticing your bum on the chair. Adjust your upper body if you feel that one side of the bum is carrying more weight than the other side. And just slide up your back into your shoulders. Let your shoulders tense, so relax. And move your shoulders gently, slightly, to release any tension that may be present. Notice where your hands are. And move your hands to a position that your hands are going to be happier. And are your fingers open and relaxed? And sensing into your abdomen. Your chest. And be aware of your facial expression. Any muscles that are tight. The cheeks or the jaws, the forehead. So this is the first step of the awareness, whatever is in the present moment. And the second step is focusing on the breath, wherever you feel it the most. just observe this beautiful breath going through your body, keeping this body alive. And feeling a sense of gratitude for the presence of the breath. Without this breath, nothing in life matters. So feeling a sense of gratitude that this breath is still here every moment, giving us time. Time that we can use to be useful, to value add, and to serve others. And now step 3, expanding our awareness back into our body, noticing our feet again, and the length of our legs, our torso, our head. And from our right hand, spanning across our shoulders to the left hand, and really sensing into the entire body that we live in. And a sense of gratitude for everything that's working in this body. Even if it's not perfect, it's good enough. And now just sensing 3 more beautiful breaths. And opening your eyes with a new sense of gratitude for this body and the breath. So I hope that helps to relax you a little bit more.
Thank you, Andy.
Thank you.
Right.
So with that, I'd like to thank Professor Choon for giving his time and sharing his experience and knowledge and his guidance to how we can maintain better mental health and not to take our mental health for granted. And we can certainly help each other maintain good mental health by being cheerful, being kind, being grateful, and not indulge in being angry and volcanic in nature, because that actually causes a lot of stress to other people. So tomorrow we will be having a mindful parenting webinar at 4 o'clock. So please do join us if you haven't signed up yet. You can go to our Facebook page and click the link. We also have another talk next week, which is on how the loss of hearing increases the risk of dementia, and many other programs coming out. So do get on our website or Facebook page and find out more. So with that, thank you once again, Professor Chua, and the sponsorship of Turbo One for this talk.
Thanks,
Have
Andy.
a lovely day.
Bye.
Bye.